And good evening. Welcome to ED Public Health Foundation Day and Virtual Conference 2020. So this is the session which will be focusing on diversified issues. And this is Naimuddin Robi, and I will be moderating this session. And first of all, it is my pleasure to introduce to you all about Dr. Professor Fatima Ashraf, and she is now working as head of Department of Gynecology and Obstetrics in Shohid Sohrawardi Medical College and Hospital. And also she was ex-chairperson of Public Health Foundation and currently working as advisor of Public Health Foundation. I'm also privileged to introduce with you about Professor Motiur Rahman sir, and he's now working as consultant of Department of Maxillofacial Surgery in Apollo Hospital, Dhaka, and he was former chairman of Department of Maxillofacial Surgery at BSM. So before I start, I want to share about with all the participants. We have 7 participants in this session that we will have 8 minutes for every presentation, and after 6 minutes I will be giving a badge to everyone so that they will know that they have 2 minutes left, and after 8 minutes I will be also giving another badge so that they know the time is completed. And now I would like to request Dr. And Professor Fatima Ashraf Madam to start the session. Thank you.
Thank you, Dr. Naimuddin. Assalamu alaikum and very good evening to you all. I am Professor Dr. Fatima Ashraf, and with me, Professor Dr. Motiur Rahman. We are welcoming you all to today's session on diversified issues, and this is the last day of Public Health Foundation Day or conference. So first of all, I would like to request our first speaker, Mr. Prashant Majumdar. He is the student Masters in Public Health Dentistry, Rajiv Gandhi University of Health Science, India. He will talk on correlation between blood group and oral health status of college students in Kodagu district. Prashant Majumdar, please.
Prashant Majumdar, can you see your presentation?
Hello.
Can you see your presentation?
Is it audible? Hello, is it audible?
Yeah, we can hear you. Can you see the presentation on the screen?
Hello, is it audible?
Yes, we can hear you.
Okay, fine. So I'm continuing. So good evening, everyone. Yeah. Sir, is it audible, right?
Yes, we can hear you.
Okay, sir. So my topic is correlation between blood group and oral health status of college student in Kodagu district. So next slide. So it is well known that dental disease can vary according to different bacterial etiology, host response, and clinical progression of disease. And gingival disease is another most prevalent dental disease with a multifactorial etiology affecting a large number of population worldwide. It is interesting to emphasize the significance of genetic factors in causation of dental disease and to find whether any in next slide. Next slide. This is because of this bacterial have surface lectin, which they use to attach the body surface. Next slide. Some studies have found that dental caries prevalence was lower in secretion group than in non-secretory groups. Limited efforts have been made to evaluate the correlation between APA blood group and oral disease. Hence, the present study was conducted they determined the association 22 years old college student. Next slides. So my objective was to know the association between dental caries and blood group among 18 to 22 years old college students in Kodagu district, to compare the association between gingival status and blood group among 18 to 22 years old college students in Kodagu district, India. Next slides.
Yes, next slide is given. Prashanto, can you see the next slide? Hello? Are you there? Prashanto, are you there?
And yeah, my methodology study source is the study was carried out among students in 5 colleges in Kodagu district. Study design was cross-sectional study. Next slide. Sir, please next.
Yeah, the slide is changed. Prashanto, are you there? Maybe we are losing him due to internet connection.
So can we continue with the slides? That he can join again.
Is it audible now?
Yes.
Yeah, so my inclusion criteria will be student in the age group of 18 to 20 years old attending various colleges in Kodagu district, and student holding a certificate copy in indicating their blood groups. Next slide. Okay, my exclusion criteria: student and teeth having restoration due to aesthetic purpose or restored other than caries like laminates, crowns, or not scored, and student who were absent on the day of examination. Next slide. So ethical clearance was taken and permission from the concerned authority was taken, and informed consent was taken from all the participants. Next. Okay, the method of data collection: a total 400 students, 100 of each blood group, 260 female and 140 males of 18 to 22 years age group, and were randomly selected for the study. Next slide. And this was my method, my materials. We can show in images. Next slides. So statistical analysis, chi-square test and one-way ANUVA was followed by the Turkey post-hoc test was used in my statistical analysis of my study. Next slide. Next. So this is the table. This is the table number 1. It shows the association between blood group and DMFT scores, in which we can see that most of the AB blood group having more dental caries compared to other blood group. So and B group was having more dental caries compared to other blood groups. Next slide. Next slides. Okay, so when ANOVA was the comparison was done for each blood group, we can show the highest DMFT means dental caries was seen in 5.41 in the participant of B blood group, and lowest dental caries was seen in AB blood group, which was a 1.55 score. Next sir. And this is the table number 3, shows the ANOVA 2.17 was the gingival highest score in B group, and the lowest score of gingival score was AB blood group. So this is the post hoc analysis for multiple comparison. So we can see AB and O. B was having more prevalence of dental caries, and respectively seen that AB is the lowest dental caries prevalence, and B blood group people having the more high chances of dental caries prevalence. Next slide. Next, okay. So we found a significant association between oral health and blood groups. B blood group had the highest mean DFT scores for dental caries, and AB had the lowest scores. And according to our study, we found that Shanmukh Kumar et al. 2017 found that B blood group had the highest mean DFT score for dentist. Next. Next slides. Next slides.
Yes,
so in okay, limitation and recommendation. My study limitation was the sample size was the less. It was only 400, and secretor status, like we didn't identify that each blood group having any secretor status. It was not evaluated, and recommendation can be there. Further studies need to be conducted considering secretor status in more larger sample. So in conclusion, we can that the present study concluded that DMFT and gingival scores varies in different blood groups and suggest a positive association between blood groups and DMFT scores and gingival scores. So as a public health significance, we can tell that knowledge of the ABO blood group of patients and their association with the dental disease is very important, as it can help in the development of early diagnosis and treatment statistics. So we can find out the we can advise patient at the we can advise patients if those who are having B blood group, they having more prevalence to dental caries, so we can take more care of the community those who are having B blood group and compared to other blood group. So we can help us to patient in early diagnosis and treatment strategies. It will be helpful as a community purpose. Next, ma'am. So these are my references. Thank you so much. Any questions?
And the oral health, like dental caries and gingivitis, and especially he mentioned that B positive has more caries disease. I don't know why this is happening. We have to really think about it and find out in a better, long term and with a big number of cases, so that we can really understand and say that this is the reason why this is happening. Anyway, thank you, Professor Dr. Prashant Majumdar.
Thank you so much, sir.
And,
thank you so much.
And our next speaker is Dr. Suring Penjor from Central Region Referral Hospital, Ministry of Health, Bhutan. His topic is today a cross-sectional study to assess the knowledge of mothers, caregivers of 1 to 5 years old children regarding the helminthiasis and its prevention and its control, Dhamrai Upazila, Bangladesh. I would like to welcome Dr. Penjor. Please present your paper.
Thank you, Chairman, moderator, and all the participants from around the world. This is Srin Penjor, as introduced by the Honorable Chairman. Today, I'm going to present a cross-sectional study to assess the knowledge of mothers of under 5 years old children regarding helminthiasis and its prevention and control in Dhamrai Upazila. This is my thesis paper, which I have written during my master's in public health from James P. Grant School of Public Health, Black University in Bangladesh. Next. As you are aware that James P. Grant School is one of the renowned public health schools in the world, and we consider JPG, James P. Grant School of Public Health, is one of the premier public health learning global classroom for public health, as hundreds of students from around the world gather there, and the professors from many renowned world colleges were invited as the professor for that school. So that makes the school very renowned. So regarding my school, my study, so background, around the world, 267 million preschool children and 568 million school children are living in the heavily soil-transmitted helminthiasis contaminated area. STH is mainly transmitted through human feces, in turn contaminate soil in areas where sanitation is poor and transmitted. Can you go back? Yeah, in children, STH infections can contribute to poor immunity, poor cognitive development, malnutrition, anemia, and poor school attendance conditions that force them to stay trapped in a vicious cycle of disability and poverty. So Bangladesh is a tropical country with enough rainfall, hot climate, moist and sandy soil, which is favorable condition for the survival and transmission of intestinal parasites. Next. There are unhygienic water and sanitation practices. Soil and water contamination is widespread in Bangladesh, which makes the situation worse. Children, pregnant women, and lactating women are the population at high risk of infection. The high prevalence of parasites is usually correlated with poverty, poor environmental hygiene, and deprived health services. Among rural children of Bangladesh, the prevalence of STH in preschool children is 25.7%, while in school-going children, prevalence is 40.1%. So weepworm is the most prevalent parasite in both age groups. Next. Specific aims and objectives. To assist the knowledge of primary caregivers on signs and symptoms of STH infection, to assist the knowledge on sources of STH infection, to assist the knowledge on transmission of STH infection, and to assist the knowledge on perceived risk behaviors of STH infection. Finally, to assist the knowledge on prevention and control measures of STH infection. Next. Methods, study design, a cross-sectional quantitative descriptive study. Study setting, Dhamrai Upazila of Dhaka district, Bangladesh was selected purposely due to its geographical proximity to Dhaka city. And it is located at the distance of around 25 kilometers to northeast of Dhaka city. As per Bangladesh population census 2011, Damrai Upazila comprises of 16 unions, 305 clusters, and 408 villages. Total area is 307 square kilometer. Total population 4,12,418. Children aged between 0 to 9 years is 81,000 something, and 2,24,922 are married. 17,000 are unmarried. 15,000 plus are widowed, and 1,512 family members were divorced. So total literacy rate is 50% and more. Next. Tools. Structured questionnaire. Pre-tested structured questionnaire was used to look into socio-demographic characteristics and the knowledge of primary caregivers. Microsoft Excel and startup version 13 was used to perform univariate analysis. Study population. Mothers and caregivers of under 5 years old children of Damrai Upazila of Dhaka district. Inclusion criteria. Mothers and caregivers of under 5 years old children who are available and willing to participate in the study. Exclusion criteria. Disabled or severely ill mothers or caregivers were excluded since they may not be able to provide complete information and it is ethically not correct. Next. Next. Next slide, please. Next slide. Next slide, please. Sample size. The calculated sample size is 352, having considered the prevalence of helminth cases among preschool children in rural Bangladesh. 25%, 25.7%, and 95% confidence interval. Acceptable margin of error was 0.05 and 1.2 as a design effect since the sampling technique is a multi-stage cluster sampling. Next. Ethical consideration. Proposal was reviewed and approved by the Institutional Review Board of Brack, James Peak and School of Public Health. Written consent was taken from the respondents for interview, and the purpose of the study along with the risks and benefits was explained clearly to the respondents before interview. Interview was totally voluntary and participants may withdraw anytime. No name and identifications of respondents were mentioned, and the data is only available for the researchers. Next. Socio-demographic characteristics. 50% falls in the age group of 16 to 25 years old, and 98.5% were female, 98.8% were married, 95.9% were Muslim, followed by other religion. 50.6% of the mothers and caregivers, they have 50% of the mothers have secondary education level. Next. Monthly income in Bangladeshi Dhaka. So 48% earn 10,000 between 10,000 to 20,000 per month, and 59% were nuclear family, and 40% were joint family. And for the education of the father of child, 39% are having secondary education level, and occupation of fathers, 22.81% are employed, 23% are day laborers, and 22%, more than 22% are doing business. Next. Key results. It is alarming to note that among total participants, 100% of the participants were unaware of routine health checkup for their children and the risks of helminth infection through a child's exposure to cattle or poultry. 97% lacked the knowledge of proper waste disposal. 94% respondents did not know about the mode of transmission. 92% lack the knowledge of risks of helminth infection through consumption of fruit and vegetable without washing. 66% had knowledge gap on wearing footwear while going to toilet. 54% lack the knowledge in terms of hand washing with soap. 22% among the total participants, they have gained knowledge about risks of helminth infection from former source of information such as health workers. Next. You can see here the source of information. In a brown color, 78% of the participants, they have known about STH from the informal sources of information, and only 22% have known from the formal source of information such as health workers. In terms of knowledge on perceived risk behavior of the primary health caregivers, so we have total of 342 participants. So no hand washing, 54%, 60% have a dirty surrounding, 66% have were not wearing sandals while going to toilet, and 92% are not washing fruits and vegetables. So 92% had no deworming, 92% had no routine medical checkup, 94% child were playing on a mud floor, 97% were do not have a proper waste disposal, and 100% child, the mothers of the children, they have the knowledge, the gap about the risks of child's exposure to animals. Next. So recommendations and conclusion. The importance of continuation of a routine deworming is evident. Since Bangladesh has stopped deworming program, it is posing a risk to their children about the rural population of Bangladesh. And health education must be promoted for the community in the areas such as importance of hand washing, cleanliness of a surrounding, proper waste disposal, benefits of wearing footwear, risks of the child's exposure to cattle or poultry, and importance of washing fruits and vegetables before consumption. So this study found that primary caregivers of preschool going children had remarkable knowledge gap on soil transmitted helminthiasis infection, and its prevention and its prevention aspects. Thereby, it is increasing the chances of massive outbreak in future among the preschool children of rural villages of Bangladesh. So that's the end of my presentation. Thank you. If you have any question, you are most welcome.
Thank you, Mr. Siring Pincher, for a wonderful presentation. And actually, we come to know the scenario of our rural population and the situation of the STH-related infections in the rural community. And we must appreciate your presentation, and we come to know that you are the winner of TDR WHO Fellowship winner. Thank you for your excellent work and excellent presentation. Thank you. Now, I would like to request our third presenter, Dr. Sridhar Kallanan Sundaram. He is the consultant neonatologist and head Department of Al Zahra Hospital, Dubai, and he will talk on the topic COVID-19 caring newborns. Dr. Sridhar, please.
Thank you for your kind introduction, and I'm speaking on behalf of my friend Dr. Kandamaran, who is one of the co-authors. He was scheduled to speak, but he couldn't join us. So basically, I mean, we all know about the coronavirus pandemic, and we will have a quick overview of that. It's a new infection, and there is constantly evolving knowledge and limited information, though we are getting more information as we go on. So we will look at basic aspects of the COVID-19 infection and the approach to care in the COVID-19 positive pregnant woman and the newborn, and also what we can do in the at-risk group. So it's, as we know, the infection is caused by a beta coronavirus similar to the one causing the SARS outbreak. It's a single stranded RNA virus. It spreads by airborne spread, mainly aerosol and droplet generation. For the babies, vertical transmission has not been proven, though some reports are there. Breast milk as a source of transmission has not been definitive as well, even though there is a possibility. The diagnosis, as we know, is made by the positive reverse transcriptase test for the SARS-CoV-2 virus on the swabs taken by deep intranasal and oropharyngeal swabs. So looking at the overall results, I mean, children are less susceptible with the mild course. There's a lower risk of severe disease among the pregnant women. So this is based on available literature. Vertical transmission is possible, though it's at a low rate. Good outcomes are seen in the horizontally infected infants. I mean, we have had a few babies with transient tachypnea or fast breathing like symptoms, even fever, diarrhea, and so on, but none of them have been critically unwell. And correlated morbidities also will contribute to the symptoms. Postnatal transmission is the commonest cause of the as I said, breast vertical definitive. There's no evidence of higher risk to the severe disease and complications among the pregnant women with COVID-19. So there is no need to electively do cesarean section or do extra interventions, treat them like a normal pregnancy. In women with symptomatic COVID-19, there may be increased risk of fetal compromise in active labor. So we have to be careful with the symptomatic mothers, oxygenate them well and monitor their progress. The initial period of with the epidemic, there were plenty of cesarean sections being done, mainly because the caregivers were not sure what to expect. But now we are back to the normal way of managing. And this we covered already. Delayed cot clamping, the CDC is not clear about whether to do it or not, but most of the centers have started doing because the benefit for the baby is more direct. And so it's better to encourage. However, skin to skin care can be avoided to minimize the exposure to the staff and others, and encourage breastfeeding with precautions. We don't need to separate the mother and the baby unless the mother is unwell and needs critical care, or the baby needs premature or needs intensive care. They can be nursed in the same room, of course, where the option is there. You can offer the choice to the parents, explain the risks, and the crib should be kept 2 meters away from the mother's bed where possible. The mother should be encouraged to wear a mask while handling the baby, wear gloves, and appropriate hygiene measures should be used as well. And testing the baby is optional if the baby is asymptomatic. And in resource limited situations, we don't need to test every baby because the management will not depend on that. If the baby is asymptomatic, they will be with the mother, they will get discharged with the mother and then managed accordingly. The discharge will be as per the standard protocol. In the Caribbean, where the data collected by my friend Dr. Kandamaran, Barbados doesn't have any reported cases. Jamaica has 19 mothers found positive in the third trimester. The 21 babies of these 19 mothers all tested negative. And Trinidad has no neonatal cases. So transmission to the baby seems to be low. At Dubai, we had also reported a case series in two sister concern hospitals, and we did not find babies to be affected, even though we had 7 COVID positive mothers. And only one of the baby was symptomatic but was COVID negative. So to conclude, I mean, there is enough information now that we don't need to be scared. We don't need to panic. The newborns are not usually affected, and the pregnancy doesn't need to be treated differently. If the baby is born to a mother with COVID positive, we just have to take the usual precautions as I detailed earlier. It's very important that we need to have coordinated multinational data collection so that we get more information. And we need to monitor this. Now the vaccine is available. It might change the overall outlook as well. So this is the take-home message. Breastfeeding should not be disturbed. Rooming in and the mother taking all the care with the precautions is recommended. And reassurance that presentation in newborn hasn't so far caused any concern. So I would like to close here. I mean, this is a publication we had recently, and this was before that brief research is said published the paper. I have a YouTube channel for parents, and you're welcome to look into it. Just enter Sridhar K on YouTube, including COVID-19. We have various videos which will be useful for both parents and physicians. So I encourage you to look into it. So if any questions, I would be happy to take it. Thank you. I'm stopping the sharing now. Thank you, Dr. Fatima. You can ask any questions if you have.
Thank you so much. Motirman sir, আপনি একটু unmute করেন please.
Sir, you have to unmute.
Okay. First of all, I like to correct my name. My name is Motiur Rahman Molla, not Motiur Rahman. Okay. I have requested earlier, you didn't change it. Anyway, thank you, Dr. Sridhar, for the beautiful presentation. And it is very important in the sense that when we had a pandemic situation with the corona, you see, and there could be always a case that mother at the time of cesarean section may show with the COVID positive cases. Then is a big question of how to deal with this. Like, for example, while doing any surgery like facial surgery, we have protocol like if we do it a positive test, the corona test 48 hours before the surgery. And if it is positive, we can either delay, or is the emergency, then we have to do it. So is there any, if you have time, we can also discuss about this. But good thing that he said that is nothing wrong with giving the baby the breastfeed. That's very important. But we have to really have a long follow-up and see what is really happening. So that's very interesting, I think. And I'd like to congratulate once again Dr. Sridhar for the wonderful presentation. Thank you. Our next speaker is Dr. Abdul Rafi, intern physician.
Sir, now is Mohammad Tawfiq Hussain Chaudhary.
Sorry. Oh, I see.
Yes, a bit changing this.
Sorry, Mohammad Tawfiq Hussain Chaudhary. And what is his then? Tawfiq, okay, then his title would be a cross-sectional study to explore the knowledge, awareness, and practice of COVID-19 among dentists in Bangladesh. I would like to welcome Dr. Tawfiq Hussain.
Honorable Chairperson, Professor Motiur Rahman Mullah Sir and Professor Fatima Madam, Moderator and my respected COVID panelist members and audience, Assalamu alaikum. I am Dr. Mohammad Tawfiq Hussain Chaudhary, working as Associate Professor and Head Department of Dental Public Health of Sapor Dental College and Hospital. Today is quite strange for me to present this COVID related research of mine, as at the moment I'm COVID positive now and remain in home isolation. Anyway, my title of the study is a cross-sectional study to explore knowledge, awareness, and practices of COVID-19 among dentists in Bangladesh. I'm also the author of this paper. Other co-authors are Dr. Ehsanul Haq Opu, Dr. Sujon Kantinath, Dr. Ashek Alahi Noor, Dr. Kulopapina Poddar, Dr. Ilyas Mahmoud, and Dr. Russell Kobir. The first case of COVID-19 identified in Bangladesh in March 2020. Since then, Bangladesh observed the steep rise of COVID-19 cases, especially in the capital. And healthcare workers are one of the most important groups who are mostly affected by the COVID because they are in close contact with the COVID patients. According to the WHO, in Bangladesh, almost 11% of total cases, COVID-19 cases belong to healthcare workers. And they are not only physically affected, they are also psychologically affected by COVID-19. However, dentists are a very important part of the healthcare workers. And this study for the first time was conducted in Bangladesh among the registered dentists regarding COVID-19. Dentists are the frontliners in this pandemic. They're the very important part of the health professional groups. However, the risk of infection among the dentists is high because of their nature of the work in the oral cavity. Dental operatory and equipment itself poses a riskier environment because they itself produce aerosol and droplets out of the patient's oral cavity. And dentists may get infected from symptomless or unrecognized COVID-19 patients. Therefore, a dentist should be well equipped with up-to-date knowledge and practice towards COVID-19. So our study objective was to know about the knowledge, awareness, and practice of registered dentists in Bangladesh, especially during the rapid outbreak of this highly contagious virus in Bangladesh. A cross-sectional web-based survey was conducted among the dentists. Dentists had to enroll with their unique PMDC registration number. Ethical approval was taken before the commencement of the study, and the consent was taken from every participant. A structured questionnaire was developed and distributed among the dentists through different social media platforms like Facebook, WhatsApp, Vibers. The questionnaire has 4 parts: background, knowledge, attitude, and practice-related questions. Basically, we also use CAP standard questions. The questionnaire was pre-tested for face and content validity. Participation was completely voluntary. Informed written consent was taken from the participants. However, a total of 184 dentists only participated in this survey, and this survey was conducted between March and April 2020. We conducted both descriptive analysis and multivariable logistic regression analysis. CAP questionnaire was dichotomous into correct and incorrect responses. Correct responses was assigned score 1, while the incorrect responses assigned 0. And later-wise, we create a sub-scale which was categorized as good, moderate, and poor score. In the result, we have found that mean age of the dentist was around just more than 31 years old. You can see that especially younger age group participated in this survey. Among the participants, about 29% dentists completed their postgraduate qualifications, while most of them were engaged in the private practice. We have found that most of the dentists have better knowledge score. Almost in most of the cases, more than 90% dentists correct the answer. Especially they give correct answer, especially in related to the symptom-related questions. However, there are some mixed responses in transmission-related cases like transmission from animals or types of COVID virus. There are some mixed responses. We have, by multivariate analysis, we have found that postgraduate educations, dentists who have postgraduate education, they are 3 times more likely to have better knowledge score towards COVID-19 than the undergraduate dentists, and it was significant. We have also found that dentists who earn more, especially more than 20,000 per month, have better knowledge than who earn less. We have found that most of the dentists have positive awareness regarding battle against COVID-19, and we have found that years of clinical experience are associated with the positive awareness regarding COVID-19. However, most of the dentists are afraid of being infected of this virus, and reduction of the patients and also reduction of their income. And while this period, majority of the dentists reduce their patient schedule, while many close their practice due to this virus. In case of practice, we have found that postgraduate dentists have 5 times better practice than the undergraduate one, but we have seen more safe practices in the younger dentists, especially who have less than 5 years experiences, and also among the female dentists. But there are some limitation of this study. The response rate was low, and this study mainly captured responses from younger and middle-aged group dentists because they're especially active in social media. Our conclusion and recommendation is majority of the dentists from Bangladesh have shown very good knowledge, awareness, and practice regarding COVID-19. However, we recommend the healthcare authorities, professional organizations, and hospitals to coordinate and conduct mandatory advanced infectious training for all the practicing dentists. Easily accessible and scientifically valid online education materials should be developed for doctors. However, Bangladeshi dentists and many physicians can freely access online courses and webinars who are posted by different international organizations. And we recommend that there should be urgent need of assess psychological, financial, occupational health, and safety challenges facing by the dentist. This study was conducted by a research group. We collaborators work together. These are the collaborators. We have collaborators from Michigan State University, Kashim University, Saudi Arabia, Anglia Ruskin University, UK. We are welcome any kind of research initiative from Bangladesh. So if you have interest for any research, you can contact me. Thank you.
Thanks to Dr. Mohammad Tawfiq Hussain Choudhury. Just to come to know that you are the COVID fighter and is still fighting. Thank you for your moral courage that you invent in spite of afflicted you are with us in this presentation. And we really understand the situation of our dentist through your CAP study. Thank you so much for your brilliant presentation again. Now I would like to request our next presenter. He is a very promising young graduate, Dr. Muhammad Abdul Rafi, intern physician from Rajshahi Medical College Hospital. He will talk on the topic pattern of hemoglobinopathies among anemic under 5 children of northern Bangladesh, a hospital-based cross-sectional study. Dr. Rafi, please.
Hello. Good evening to all. Let me share my screen. Am I visible? Is my screen visible?
Yes, we can see you.
Yes.
This is Abdul Rafi from Rajshahi Medical College. I'm doing my internship, and my today's topic of presentation is pattern of hemoglobinopathies among anemic under 5 children of northern Bangladesh. Congenital hemoglobin disorders are one of the major public health concerns worldwide. Every year, more than 330,000 babies are born with a clinically significant hemoglobin disorders, and it is accountable for almost 3.4% of all under 5 deaths all over the world. According to the evidences, beta thalassemia and hemoglobin E disorders are more commonly found in Southeast Asian countries, including Bangladesh. Our BDHS data shows that more than half of the under 5 children of Bangladesh are suffering from some extent of anemia due to different causes. But the contribution of the congenital hemoglobinopathies to this disease is still quite unexplored. However, there are some data I would like to share with you that among the healthy children, the prevalence of beta thalassemia trait was reported as 4.1% and hemoglobin E trait was 6.1%. That was alarming. Hence, the aim of the present study was to investigate the prevalence and pattern of hemoglobinopathy among under 5, aged between 6 to 59 months, visiting the hematology department of the Rajshahi Medical College Hospital. This was the cross-sectional study in the hematology department of Rajshahi Medical College Hospital conducted between 2018 and 2020. All the recorded data of the patients visiting the department aged between 6 to 59 months during this period with the diagnosis of anemia, that is hemoglobin level less than 11 grams per deciliter, were included in the study. Patients suffering from malignancy or other chronic diseases were excluded. Frequency distribution with percentage was used for nominal variables, and mean with standard deviation was used for continuous variables. A number of 534 under 5 children were included in the study, and you can see here almost 30% of the children were between 6 months, 11 months, and the rest of them were more than 1 year. The sex ratio was 50-50, and here is the level of anemia. 36% of the participants were suffering from mild anemia, that is 10 to 10.9 grams per deciliter of hemoglobin, and 37% were suffering from moderate anemia, and 26% were suffering from severe anemia, that is hemoglobin level less than 7 grams per deciliter. Here is the prevalence of hemoglobinopathies. Almost 2/3 of the anemic under 5 children were normal, while 1/3 of the anemic under 5 children visiting our department were suffering from some extent of hemoglobin disorders. Here is the sex ratio according to the prevalence. Among the female children, the prevalence of hemoglobinopathies was almost 35%, and among the male prevalence, it was 34%, which is not statistically significant. Here is the pattern of hemoglobinopathies among the 30%. Among the 30% children who were suffering from hemoglobinopathies, almost 41% were suffering from E beta thalassemia, which was the commonest form of hemoglobin disorder, followed by hemoglobin E trait, beta thalassemia minor. And some other hemoglobin disorders like beta thalassemia major or alpha thalassemia was canteen. Here we're showing the hemoglobin level of the participants suffering from different hemoglobin disorders. Here you can see that patients with hemoglobin E beta thalassemia were suffering from most severe form of anemia. The mean hemoglobin level was 6.5 gram per deciliter, followed by beta thalassemia major and hemoglobin E disease major. Patients with hemoglobin E trait and beta thalassemia minor was mostly suffering from mild to mild form of anemia, which was expected. However, the hemoglobin level of the participants cannot be generalized, as some of the hemoglobin disorders, prevalence of some of the hemoglobin disorders were very less. The present study provides a bird's-eye view about the pattern of thalassemia and other hemoglobinopathies among anemic under 5 children attending the study site. Despite this fact, some limitations would be worth mentioning. Firstly, the study was a facility-based study that included only the anemic children visiting the study center, mostly for treatment of anemia. So we have obviously missed the most of the anemic children residing in the community. As a result, the anemia status and prevalence of hemoglobinopathies do not represent the community picture. And moreover, detailed socio-demographic, clinical, and laboratory parameter data of the patients was not available. Our study found that more than 1/3 of the under 5 anemic children visiting a tertiary care hospital were suffering from some sort of hemoglobin disorder. E beta thalassemia, thalassemia E trait, and beta thalassemia minor was most common type of hemoglobinopathy in the study site. And we recommend that further exploration in the epidemiology and risk factors of hemoglobinopathy in the region, mostly in community-based studies, will guide to evidence-based action plan to decrease the disease burden. Thank you for patient hearing. I'd like to request for questions.
Please unmute.
So, can I say something now? Okay. So, thank you, Dr. Abdul Rafi, for a beautiful presentation. And his research, I mean, the methodology was quite nicely presented, I would say. And anemia in this country is all along a big problem, especially in the rural area, as we all know, especially children. And he was talking about the thalassemia E trait, which is again a tremendous problem, which is sometimes undiagnosed. And many of the patient comes to us in the adult and been finally diagnosed with thalassemia or E trait, you see. So there should be some sort of initiative from the government or some places where it could be some, I mean, the bank or something where they will encourage the patient to come and report with the problem. And like in foreign country, these patients can be regularly registered and treated nicely. Anyway, I would like to congratulate again Abdul Rafi for a beautiful presentation. Thank you once again. Our next speaker is Dr. Sejuti Shimanta, Abdul Rahim Medical College, Dinajpur, Bangladesh. And she'll be talking on COVID-19 pandemic is making ministerial health work in Bangladesh, a cross-sectional survey. So I would like to welcome Dr. Fatima, please.
Dr. Sejuti, we can see your slides, but we cannot hear you. So can you unmute?
Thanks a lot, but I'm apologized for this inconvenience. Actually, I'm not a doctor. I am only a fourth year medical student. First time ever, I have written something on in this to present in this Public Health Foundation Day. So I'm apologizing at first. And I'm so nervous because all those participants here is so much honorable doctors here, and I am only a fourth year student. Whatever I am starting.
Please go to enable editing first. Then your slide will be brought on most probably.
Okay.
Yeah, this one on your right side probably. Enable editing.
Okay.
Yeah.
Thank you, ma'am.
So can you go to the slide share mode?
Slide share mode. Okay.
On the bottom of your page, you can see a sign slide share.
But these slides is deposited with RAS-TV. Could it be more comfortable for Shijiti?
ম্যাম এই স্লাইডটা আমাদেরকে দেওয়া হয় নাই।
Okay.
Okay. If you are not comfortable, I can share the slide.
Okay, sir. It will be an honor if we if you share.
Okay, do that, Robi. Please do that first, Shijiti. Okay, thank you. Thank you. You first off your slide share, Shijiti. Off your slide share, please, Shijiti. Okay, thank you.
I'm just tired.
Is there any problem, Robi? Can we call the next presenter? By this time, you can keep it ready.
Ma'am, it's okay. Just sharing the slide. The Zoom is hanged. So yeah, now it will work.
Okay, fine. Thank you. We are actually in shortage of time.
I think you guys can see the slide. I'm going to slide share. There you go.
Thanks a lot, sir. I am Shejuti Shemanto, fourth year student from M. Abdur Rahim Medical College, Dinajpur, and I have written and conducted a survey during the month of October with my partner Jayati Chakraborty. She is also a fourth year student to write this abstract. And our title is COVID-19 pandemic is making menstrual health worst in Bangladesh, a questionnaire study. Okay, next slide, please. Thank you. First of all, I like to say that the menstrual health is not openly discussed in Bangladesh due to social norms and cultural beliefs around body and blood of a woman or a girl. So girls are usually lack of the necessary skill and information to maintain their hygiene during their monthly period. So when this is the common situation in our country, and that's the background, women's menstrual well-being needs, which can be physical, mental, or financial, are commonly a low prioritized issue in a developing country like Bangladesh. So as of now, this nation's financial state has been endangered due to COVID-19, which disregarded the women's health gravely. And this COVID-19 situation has made every single possible things which was possible before is difficult for us. So this issue is also have become tough for us. Next slide, please. So the rationale of our the abstract is the fundamental reason for conducting this is to find out the current state of consciousness regarding menstrual health among menstruating women, as this issue has been neglected since before the COVID-19 pandemic situation, and this current pandemic has caused a severe deterioration in the maintenance of menstrual health. Next slide. The objective and aim was the investigation focused on conditions like availability of menstrual hygienic products and nutritious items, accessibility of social, familial, and financial health, and overall physical and mental emotional well-being. Next slide, please. Okay. We conducted this study by a cross-sectional investigation utilizing a distinct questionnaire was directed with 263 ladies between 12 to 42 years old. The examination populace was picked from the social and financial variety from roughly 9 territories of Bangladesh. As we have prepared a Google form and we surveyed through online, and we also have prepared some written copies, and we distributed these like beside our household, like the slums around our house and the working people who works at our house or beside our home. So we tried to uh, prepare a random selection process from the every social or economic class of people, so that the result of our survey is not narrowed down in a specific socio-economic class. The result was like from about 263 examination of people, 43.7% of the population faced issues concerning with their hygiene and well-being during COVID-19, and 17.1% of this problem not occasionally, and the main problem was to inavailability of nutritious food, and the transportation issues, and the economic issues, and the priority issues over other familial problem. Then 38% of the populace faced problems due to their insufficiency of nutritious food during the COVID-19 pandemic. 19.4%, 62.5% of them has faced issues due to economical crisis. 56.5% of them faced issues due to transportation problem, and 37% of them faced issues due to the lack of the priority of their period. Then the population's family doesn't give importance to their issues, that the period is a common basic health need during the pandemic situation. Next slide, please. And 42.6% of the populace was nutritiously lacking. 60.5% of the people confronted different physical and mental distress from their family, and 52.5% of the family has cut their budgetary arrangement for absorbent of nutritious supplement. And moreover, there is like 22.5% of the populace who have shared that there was budgetary arrangement for them before the pandemic, and during the pandemic there is no budgetary allotment for their period issues in this time. And the conclusion is during this COVID-19 pandemic, families and even the public authorities ignored the subject of the convenience of the assets expected to guarantee feminine hygiene of the female population, though it's their fundamental right. And the result of the examination proposes putting resources into feminine well-being by giving affordable retentive items and nutritious supplements, both by the government and like non-governmental NGOs. Additionally, it is essential to give priority to this fundamental issue by encouraging individuals from all perspectives. Thanks a lot for giving me this opportunity, and I'm extremely sorry for all the inconvenience because of my lack of experience.
Thank you, Shijukti. Being a fourth year student, you have a very good observation power, and we really enjoyed your presentation.
Thanks a
So
lot,
we are
ma'am.
thankful, and I want to thank you for your brilliant presentation. We hope you will hold your spirit and go ahead with research. Thank you very much for introducing us with a very common issue and a very neglected issue in this country. Thank you. Now I would like to request our next speaker. He is also a student from Shohid Ziaur Rahman Medical College, Bogura, Bangladesh, Sabir Ahmed Osmani, and they will talk on the topic nutritional aspects with impact on non-communicable disease prevalence in South Asia, a review. Sabir Ahmed Osmani.
Sabir is going to present in another session. So there is Arvind Shantosh. Dr. Arvind Shantosh will be presenting.
Oh, sorry. It has been changed. It was supposed to be. Sorry. Okay, thank you. So now I will request Dr. Arvind Babu. Is it Arvind Babu?
Arvind Shantosh.
Yeah, Shantosh. Arvind Shantosh. He is the senior lecturer and a research coordinator, School of Dentistry, Faculty of Medical Science, University of West Indies, Jamaica. And his title is Patient Communication During COVID-19 Pandemic, Oral Tissue Perspective. Thank you.
All right. Thank you, Public Health Foundation, for giving this opportunity to speak on this title today. I am happy to see the chair. One of the person is a oral maxillofacial surgeon, and I was also happy to see some dental presentations here. My co-presenters or co-authors of this presentation are Dr. Kandamaran, who is a neonatologist, and Dr. Susan Isaac, who is a prosthodontist, Dr. Reddy, who is a oral and maxillofacial pathologist. So the title of this presentation is a patient communication during COVID-19 pandemic, oral tissue perspectives. Before I get into the presentation, I would like to state that this is not a research study, and this is just a perspective that we come across from following to reading some papers that to present our thought process. I hope this will be helpful for the primary healthcare servers and not just the dentist. So as we all know that COVID-19, almost it was 1 year ago, it started in China and started spreading across the world. Somewhere in the March 2019, it was being labeled as a COVID-19 pandemic. Most of the prominent clinical features for the COVID-19 infection was related to the acute respiratory distress. And then there were some systemic symptoms were also presented. Initially, there were no oral symptoms, oral cavity presentations were reported. However, slowly as the studies progressed, as the case presentations started reporting, it was consistently seen that the dry mouth and the loss of taste sensation were being significantly associated with COVID-19 infection. All right. So hence we could suggest that we could probably assume that dry mouth and the loss of taste sensation may be considered as one of the oral manifestations in COVID-19 infection. As we all know, the nasal swabs were the routine method of collection for laboratory analysis. And however, we all know that oral pharyngeal swabs also will be considered in the part of laboratory analysis. And even few studies try to consider to collect the salivary samples for the analysis. So before presenting my thought process, I would like to show you the basis of thought process that we all know that the human cell has where the human cell has a ACE functional receptor, that is angiotensin converting enzyme receptor, and that is the entry site for the COVID virus, and it can target into that and get into the entry into the cell, human cell or host cell. So the interesting part is that the expression of ACE was actually seen in the respiratory tract epithelium. Similarly, the ACE2 expression was also observed in the salivary gland ductal epithelial cells. And also the studies started proving that that the ductal epithelial cells of the salivary glands are the early target for the SARS-CoV virus infection than the respiratory tract epithelium. The study suggests that the ductal entry promote the virus to get inside the cell, the salivary gland epithelial cells, and causes a viral proliferation in the salivary gland. And once the viral load gets increased, then it gets into the respiratory tract epithelium. So while it is present in the salivary gland epithelial, salivary gland tissue, it appears that it starts the lesions and starts showing the symptoms way earlier than respiratory tract infection. So recently report that mentioned about nCoV, that is novel coronavirus infection, suggested that 91% of salivary samples showed a positivity for the coronavirus, right? So as I said previously, the salivary studies shown that it has been showing the early symptoms than the lung infections, symptoms, and it was detected at the median of 4 days. The symptoms can be seen as early in oral cavity. And the symptoms are that basically dry mouth, although it is a very complex symptom to understand and to diagnose, and loss of taste sensation. Dryness of the mouth is a process which is likely to begin from reduced salivary flow. I would like to restate once again, dryness of the mouth may not be the immediately finding that we can see it in oral cavity, but it is likely to start with the reduced salivary flow first, and then slowly the dryness progresses. When the dryness occurs, we can see the mouth is completely dry, right? So here, the main objective is that once we have the dryness, we can use this as a tool to communicate with the patient when we communicate with our patients, right? So this may simply include that we can ask them, does your mouth feel dry sometimes, or recently do you feel your mouth is dry? So this may be helpful in understanding a person who is asymptomatic, who may not be having a lung infection or cough and other presentation. We can ask them these simple questions. And do you feel that saliva in your mouth has recently reduced? And however, we must take a care. If the patient says yes to that, we need to ask additional questions. So we must ask additional questions like, are you diagnosed with any other medical conditions? If yes, ask them what are the conditions. And we must ask the questions like, were you diagnosed with rheumatoid arthritis, Sjogren's syndrome, and SLE or SLE? Because these are the conditions usually associated with dryness of the mouth, and to prevent the overlapping thought process. Have you received any radiation therapy in recent times? Because that can be associated with dryness of the mouth. Or are you taking any medications currently? As we all know, and the anticholinergics and anti-epileptic, antipsychotic drugs can be associated with the dryness of the mouth. So classifying the dryness of the mouth into, this is taken from one of the publications recently. It can be classified to mild, moderate, severe, and the mild xerostomia can be focusing on the questions like, do you feel your mouth is dry in recent times? Do you sip liquids to aid in swallowing dry food? So then yes, may be likely to be a mild xerostomia. And with we need to ask the patients like, do you feel thirsty very frequently? Do you have a difficulty? I'm sorry, I see here some crossover. Do you feel any difficulty swallowing any food, or do you feel any thirsty that very frequently? That may be applicable to the moderate xerostomia. Does your mouth feel dry throughout the day? And do you chew gums, hard candies, minutes daily to relieve the oral dryness? If the patient say yes, it's likely to be a severe xerostomia, right? So to conclude my presentation, I would like to state like this. Over the years, much importance is always given for effective doctor-patient communication, which I believe serves as a central clinical function in understanding the disease presentation. Till to date, many health practitioners believe that doctor-patient communication is just not the art of the medicine, but also heart of the communication. Identifying the complete dryness of the mouth can be made from an oral examination, whereas identification of reduced salivary flow is dependent on good history taking before we start actually seeing the patients, right? So presence or absence of dryness of the mouth or a xerostomia may not fully helpful in identifying asymptomatic or symptomatic COVID patients, but can alert the physician, doctor, health practitioners in this pandemic situation. I once again thank you for the presentation. Thank you for this opportunity for giving this presentation. I would like to state that our thought process was being shared with the International Journal of Clinical Practice, and it was accepted and published in August 2020. Thank you.
Please unmute.
Is it our last speaker? Okay. Reason including right from medical conditions or the drug-related thing, and you have brought here something different. And I'm not pretty sure about your. I understand your classification of xerostomia and how in future we can possibly correlate with the COVID infection also. Maybe we need to have further studies, but it is quite new things that we should consider, and I would really like to thank you once again. Thank you, Dr. Santosh.
Thank you, Professor. Thank you, Chair.
Thank you. We actually passed a precious more than 1 hour time, hearing a lot of important research works. And all the presentations were on good scientific basis, innovative and very striking. Thanks to all the presenters, participants of home and abroad, today's moderator, and my co-chair, Professor Motiur Rahman Mullah sir, for a wonderful session. And I must pay thanks to RAS TV for synchronizing everything nicely. Now I'll request Dr. Naimuddin Robi to declare the closing of the session, because we have no time to go for question and answer session. Thank you all once again. Robi, please declare the closing of the session.
Madam Chair, I don't see him in there.
Okay, no problem. So we can declare closing of this session. Thank you very much once again. Thanks to everybody.
You're welcome and thank you.
Thank you very much.
Okay, there is a problem in Robi's network. Thank you, Robi. It has been finished. Thanks to everybody. Thank you. Thank you, sir.
Online শেষ হয়ে গেছে এখন ম্যাডাম?
Sir, you want to talk more, sir? You can, sir, if you want to talk more.
You are watching Raj TV, Jagorone, Bangladesh.